I often get asked the same question. What should I expect at pelvic floor physical therapy? And while I can't speak to everyone because we all have different approaches and different techniques and different ways we conduct our appointments, I will talk about what to expect in an appointment with me at my practice, Pelvic Wellness and Physical Therapy. Your appointment actually starts long before you actually come into my physical office. I ask that people complete their paperwork online at least 72 hours before the appointment because I actually look at your intake paperwork before you come in. One, so I can make sure that you're appropriate for pelvic floor physical therapy. I want to make sure I'm not seeing something that I think would be appropriate for a different type of provider. But also, it gives me a chance to really think about questions I want to ask you and what I think might be going on. It gets my brain starting to think about what could be happening and what I kind of anticipate we might want to look at. And again, questions I want to ask and more information I think I'm going to need. The first visit is honestly a lot of talking. You would be sitting in this chair in the corner here, or you can stand, or you can sit on the treatment table, however you're most comfortable. But we're going to talk a lot. I want to hear what's bringing you in. You know, if anything's changed since you filled out the paperwork, and I want to ask you a bunch of nitty-gritty questions in regards to what you wrote down in the paperwork and what you're telling me now in person, but I also want to ask a lot of nitty gritty questions about your bowel function, bladder function, sexual function, so I can get a better, like, full understanding about what has been going on. This is why my initial visits are always scheduled for 90 minutes, because I want to make sure we have time to talk about what's been happening so you don't feel rushed. I can get a very clear and thorough understanding of what has been happening and what's bringing you into my office. And I always ask, what are your goals in working with me long term? But I also ask, is there anything in particular you're hoping we accomplish in today's appointment? Is there anything that you really want me to look at today, or anything specific in today's visit that you hope we accomplish? So once we finish talking, I feel like I have a good understanding of what's been going on, what your symptoms are, what your goals are in working with me. I will go over what I want to do in terms of a physical examination. I may, at that point, ask you to stand up. I might look at your posture. I might look at how well your back moves, your hips. But then most likely, I will recommend that I want to do a hands-on physical exam. Any part of the physical examination is always up to you. You are welcome to decline any portion of it. But the first thing I always want to look at is all the external muscles that attach to the pelvis. So the muscles in the abdomen, in the hips, the glutes, the legs. I may not look at every single structure the first day, but I will look at what I feel is most relevant to why you're coming in. And the reason I want to look at these external muscles is because they're all attaching at the bones of your pelvis. So here's the front of the pelvis, the pubic bone. Here's the back, the spine, ending in your tailbone back here. So the muscles of the back attach here. You have your glutes and your hip muscles are back here. The abdominal muscles attach here, and the muscles of the legs are attaching here as well. So all of these muscles, if they're attaching at your pelvis, can influence what's going on with the pelvic floor muscles, which are the muscles inside of the pelvis, as well as these muscles that are attaching and wrapping around in this model. This is someone with a vagina, so these muscles are wrapping around the clitoris, the urethra, the vagina, and the anus. In someone who has a penis, it's the same, except there's one less hole here. So it's the muscles that are attaching at the base of the penis and wrapping around the anus. So I want to look at all the external muscles. So I might be looking at how well you can engage your deep abdominal core muscles. I might check and see if you have something called a diastasis recti. I'm going to look at what these muscles feel like, if I feel any areas of tension, how well the fascia or the connective tissue moves over these structures. But I do a pretty extensive external musculoskeletal examination. And then, depending on why you're coming in and if you consent to it, I would like to probably do an internal pelvic floor examination. That would either mean one gloved, lubricated digit vaginally or rectally. If someone has a penis, the only way I can assess these deep internal pelvic floor muscles is through an internal rectal exam. Again, this is all with your consent. It is optional, but it is one glove lubricated finger. So I can assess these muscles inside the pelvis. So I can see, what do they feel like? Are there areas of tension or overactivity? And I want to see how well can you control these muscles. So can you contract, relax, lengthen your pelvic floor? I will most likely do a visual assessment in someone who has a vulva. I want to look at the skin and the tissue around the vaginal opening before I do the internal exam. If at any point during the internal examination you want me to stop, take a break, at any point you can let me know. I don't use a speculum. I don't use any tools. There's no stirrups. It is just one gloved, lubricated digit. So I can assess these muscles, see what they feel like, see how well you can control them. Then at the end of the exam, I will step out, you will get dressed, and I will come back in and we will talk about what I found, what I think the plan should be, and what I want you to start doing at home. I always email my patients all of the exercises and resources that I go over at the end of the appointment. And then I always make sure that there's time for us to talk, you'd ask any questions, and then we decide if we're going to schedule any follow-up visits or if I feel like I want you to consult a different practitioner at that point. But that is typically what happens at the first visit in my practice. And future visits kind of depend on what I find during that appointment. It may be more hands-on manual therapy to address any impairments in the muscles externally as well as internally. Again, any part of my recommended plan of care is always optional, and we collaborate on the plan going forward. In each visit, we always have a conversation at the beginning about how things have been going, what's changed, and what I plan to do in that visit, and let you know what I'm thinking. And you can always say, like, okay, that sounds good, or no, I'd prefer we don't do this today, or I'd like you to not work on this area today. And that's always fine. We always have a conversation and make sure that you are on board with what the plan is. But that is what to expect in the first visit at my practice, Pelvic Wellness and Physical Therapy.